today, and indeed the next few days, you're going to hear some amazing stories from some truly inspiring patients. And each one of those stories is just as important as the next one you'll hear. We're a family at Medicine X, and everybody is included in that family, and that's the journey we're going to take you on as patients over the next few days. And as the first ever patient in residence at Medicine X, I get to share a little bit of my story with you first, and hopefully start the conversation. There we go. At 12, I was diagnosed with Crohn's disease, an incurable bowel condition. At 14, I had my first surgery, and at 16, I had a conversation that really shaped how I engage with my healthcare in the future. I went to meet a very eminent gastroenterologist in London. He ended up becoming the Queen's physician. And he said to me this, he said, "I will only treat you if you take as much responsibility for your care as I will. We're going to be a team, and we do this together." And he taught me what blood results meant for me, and he taught me the important markers in my life, and he taught me that actually healthcare is simply about a relationship. 7 years ago, after 25 surgeries, I ended up with intestinal failure and a bowel down to 40 centimetres. And 5 years ago, I became the 11th patient in the UK to undergo a rare small bowel transplant. I'm a 2-time cancer patient, and I inject 4 times a day, and I've spent most of my life attached to medical bags. But the truth is, you really only understand a problem when you start connecting with others who have been in similar positions with you. And for me, it's about that human-to-human connection. When I was going through my transplant, my family were being contacted continuously. What's it going to be like? Is he going to survive? 5 of the first 10 hadn't made it off the operating table. I started a blog, and the only reason for the blog was so that phone calls didn't have to arrive at home. And my transplant team started reading it and then handing it on to medical students, and in the space of 12 months, 100,000 people were connecting through this blog. And I turned to social media and I said to patients, "How do you cope?" And the overwhelming feedback was, "You have to get on with it. This is the life. This is what we do." And so I began to understand what the value of that human-to-human interaction is, and started to take control of how I was going to improve my life. I had 9 months in hospital after transplant, and I was attached to an ostomy bag. For those of you who don't know what it is, an ostomy is where part of your bowel is brought to the outside of your body, and your bodily waste is collected into a bag. Those bags leak and they spill, and the doctors want to know how much data is in that bag, because it helps to determine how your gut is functioning. The nurses, and believe me, I timed it, on average take about 8 minutes to come to your bed, empty the bag, scribble on the back of their hand what the output volume is, and then try and remember to put it on a fluid balance chart. And all I wanted to do was just get back to a normal day, a normal life. Except I'd bounce in and out of hospital. 25% of patients like me get readmitted every few weeks. Big dehydration issues. Costs go up and down, and I just wanted to get back onto life. So I bought some product off eBay, and thanks to the wonders of YouTube, hacked together a sensor. 11 Health was born a little while later, and now we have an FDA-approved device that's undergoing clinical trials in the US. It's engaged with 20 hospitals, and 11 Health was born. But the truth is, I'd found a solution to myself that actually that wasn't the whole answer. Because when you're building technology, it has to impact and it has to be of benefit to everybody who is part of that conversation. And I've been privileged at Medicine X over the course of my 5-year involvement, and this year in particular, to be part of crafting this everyone included model. And everyone included is very simple. If you're building a solution, if it impacts everyone, it has to be of value to everyone. So start the conversation with everyone in the room together. And when I'd walk up and down the wards with my device beeping and telling me now that my bag was filling, my doctors would go, "So what? Doesn't help me. I still need your data. How much shit is in that bag?" So we started the conversation and we built a software solution with the nurses, with the doctors, with the insurers, with the hospitals? How does it interact? What is the relevant data you as my doctor need to see, and where do you want to see it? You want to see it in the MR? Technology is available to do it. Just because people say we don't want to do it isn't the barrier. We understand the solutions together. And for me, it was very simple. I'm taking a dumb object that is a collection vehicle, a vessel, and trying to turn it into a smart object that delivers real-time intervention, that helps stop me bouncing back into hospital and the hospital being dinged all the time for readmission, or improve my self-management so that the patient experience coming out of surgery is a great one. Those are the challenges that we as patients are trying to solve, and you can only do that when you all come together. And ultimately, I wanted to deliver a personalized intervention in real time. Didn't want to have to wait for what was going on. Technology wasn't the barrier, it was the human-to-human interaction that was the barrier. And then we came to the world of insurance. Now, as you can tell from my accent, I speak the Queen's English. It's the only real English around. And I'm lying there in the UK, or actually I'm at my desk in the UK with the NHS. The NHS is, single payer. And I go around the country to patients, just assuming they pay. At the time, 50, 60 pounds for my device, and the patients were like, we don't pay for anything. The NHS will give it to us. And right now, in the UK, we announced a few months ago that there's going to be a technology tariff, the ability for technology to be prescribed. And so you will be able to go to your GP or wherever it is, and instead of getting a medication, you might actually get a technology solution. And then I Googled, what are the barriers in America? Insurance came up. And I Googled, what does US insurance look like? I'm just a dumb Englishman. And it got me to Medicare. And I phoned them and said, barrier to entry for my product is who's going to pay for this and how can I do it? Can I come and sit with you? And can I come and meet with you? And can you explain to me how I'm going to do this? And they went, yeah. If you want to waste your money, come out and talk to me. And we did. And we found out that ostomy supplies, get reimbursed. Ostomy bags are treated like a prosthetic. They have to be reimbursed to some degree. And then you go, but I've got a technology solution that sits in that space. Does it qualify? Is it the same as a barrier cream or a belt or another ostomy supply? And you get told, don't know. But I'm like, we've done this data. We've shown we've reduced readmissions by 30% in the UK. We have 98% approval rating from patients. We have doctors that want it. Can we not just get a code? Doesn't work that way. How does it work? Still waiting. I wanted to put a slide up here for the list of how many pages there are on Google when you Google to get your own code. It's thousands upon thousands. But as a patient, how do you navigate that system? As a technology company, how do you navigate it? We now have 2 people dedicated to us in our team to help patients get reimbursed. And we have a code, somebody described it as a dump code, but a code that allows it to be reimbursed to a degree. But you want surety for patients, and you want that confidence and that ability for patients to be able to know when they have something that adds value, when the hospitals see the value, when insurers see the value, when doctors see the value, that actually it gets compensated in the right way. How do we do that? And so I'm going to conclude before this timer dings me, tells me to get off stage, back to where I started. Actually, perhaps the greatest underutilized resource in healthcare really are patients. But in truth, no solutions will ever scale unless we all come together and we all solve those solutions together. That article about my transplant actually only occurred because my daughter at the time wanted to have her picture in the newspaper. And I was a rare guy with a transplant, so we did it. The reality of that article was that 4 patients ended up having a small bowel transplant who never even knew it existed before that article was in the press. Their doctors didn't even know the transplant existed. That's the power that we have together to solve real problems. So my challenge as we go through today and we start to think about new models of care, the new landscape, how do I want to consume my health? I want to consume it in the way I do everyday life. And I want to give value back to the system. I don't want to be a drain on resource. Patients like me are the biggest pain in the arse you can be. We are managing long-term multiple chronic conditions. We cost a fortune, we know we do. But often if we have a solution, and that solution can be validated and is wanted, how do you scale that? How do you get it paid for? That's where we need your help. Right now, I interact with my doctors on WhatsApp every day. That's the communication vehicle I want. How do we come together to solve those challenges? Thank you.